This is 6:03. We were just giving a few people to join in, 3 minutes. And I want to think probably we are now all in. And if others are going to be joining us, they will find us on the way. Could I just kindly request, ladies and gentlemen, that we mute ourselves so that we maximize on the IT systems here. At times they tend to be very, very temperamental when everybody else is on speaker. And also, if possible, could we try and mute our cameras as well, so as not to so as to give the IT a chance as well. And whenever you are given the opportunity to speak, then we would ask you to unmute, or you would unmute yourself. All right. Good evening, everyone, and welcome to this webinar, Access to Public and Health Services for Diverse Communities in West Sussex. I am hoping today within this webinar, it is not only going to be us listening to presentations, but we are also going to actively participate in the discussions that are going to be taking place, mainly within the Q&A session, which is the second part of the discussions. But otherwise, the first part, we are going to be having presentations from various speakers. My name is Gulu Sibanda. I am the locality lead within the Communities Directorate, West Sussex County Council. And for my sins, within my role, amongst other things, I have the responsibility of encouraging services, partners, colleagues, and partners here, I mean both internal and externally, to make sure that we embed the concerns, the needs, the wants, or whatever you call it, of the BME and minority communities in whatever services we are delivering. If we are to take up an initiative, if we are to develop an initiative, did we think about how that initiative is actually going to impact on or involve the BME and minority communities? So hopefully today within this session, we will be able to be discussing issues around that area. I am also the BME staff group lead within West Sussex County Council, where we engage with senior management to look at policies, to support our own members, and any other issues really pertaining to bettering the experiences of BME and minority staff within the organization. Now, before introducing the webinar, its aims and objectives, allow me the opportunity to thank our colleagues, West Sussex CCGs, that is the Clinical Commissioning Group, together with DRI, Diverse Resource International, for pulling together this event. I've no doubt this event is actually going to be an insightful one, where we are going to be hearing from those with lived experiences, those that are of minority community themselves, the individuals, or they belong to a community, and them sharing with us their experiences and what it is like to be a BME, and also the works that they actually do out there in the community. On numerous occasions, we have heard, some of us probably have heard, some might not, complaints or voices being raised by members of the BME community about how prescriptive services are. And the prescription here being that there are projects that are developed and they get sent out to BME and minority communities. And then when these services don't receive any traction, when they don't get any uptake from the BME communities, the services or the partners tend to get surprised. Why so? But when you talk to the BME and minority communities, they will tell you that we haven't been involved. We haven't been asked. So all these services are actually being brought to us rather than us being part and parcel of the development of those services or the initiatives. So in a way, services are actually doing to, rather than working with, the minority communities. The voices of the minority communities themselves have not actually been heard or have not been part and parcel of the development of that service or a project, if I might put it that way. So I'm hoping, therefore, that within this session today, or within this webinar, we are actually going to be demystifying whether it's a myth or it's the truth that services are not engaging, that services are doing to. Today, we are probably going to turn it upside down and say, okay, fine, let's work together. Now, through this listening and sharing event, services will have the opportunity, like I said, to hear from those with lived experiences, those that are working within the community, those that have developed services themselves. There are some here that have got vast experiences. They are retired from wherever they've been working. They have got the knowledge of the places where they've actually been working and how those services that they have now developed themselves are impacting or are improving on the lives of the BME community. So we are going to be hearing vast knowledge, experience, and the qualifications and from these individuals. Now, of course, what we know from the event itself, the main aim, like I've just stated there, is let's get to hear from the BME. What are the needs? What are the barriers? What are the challenges? Where are the inequalities? Where are the opportunities? Because we shouldn't just be mourning. Let's also talk about how we develop those opportunities. Let us be proactive. It can't be a morning show. We as the BME and minority communities, we do know of the solutions. Let us be part and parcel of those solutions. And then, of course, we want to think that at the end of the session, we will be looking at recommendations. We will be taking away some deliverables. And when we come back at a later stage, we will be saying, this is what we discussed at that session. This is what we agreed. And we went away, we developed some solutions, and here we are reporting back. These are the wins that we have actually had as a result of the event. Now, the webinar, like I said, is going to be in 2 sessions. Of course, the session there is the presentation from the speakers that we have lined up. And the second one is the participation from all the attendees. Let's have your say. Don't shy away from having your say. No one here is actually going to be marking us. There is no right or wrong. We are all making contributions. So please feel free to make those contributions. Speakers have got 10 minutes each. So I'll be on the lookout here, or somebody's going to be on the lookout, timing the speakers 10 minutes. There are going to be very, very burning questions from some individuals. We would look out for those burning questions. We might have 1 or 2 questions that might be asked. Once that individual has actually done their presentation, we go through a question. But the majority of the questions, we will reserve them for the Q&A session where everybody else is going to be participating. Please, like I've just said, let's look out for that mute button, both on the speaker one and on the camera. And whenever we are making our contributions, let us not attack the individual. Let us engage what the individual has actually said, and let us discuss professionally. And I know I'm only repeating this. In here, I know there is people who are forward-thinking, who have an interest in this webinar, because we are all progressive and we want to make a change, and a meaningful change for the BME communities. And one of the things that I would want to drive out, or what this event would like to drive out, or even me expressing, is in meetings that I'm going to all the time, I've always heard that BME communities are hard to reach. Here we are. Today, I'm told there's about 80 or 85 of us, and there's quite a number of BME in this group today. We are not hard to reach. You have to get to the right way of actually reaching out to the BME communities. And don't always think about communities, think about individuals living within that community. So don't look at BME as communities all the time. They are not communities, they are individuals living in the area. Now, without further ado, I would like to introduce the very first speaker, who is actually going to be giving us an outline. Just one little second here while I'm trying to bring up my own screens. I've got double screens opened here. And this here is Tom Goodridge, who is actually going to be introducing West Sussex CCG role. Tom, all over to you, sir.
Thank you very much, Gulu. I hope I will try not to be 10 minutes because I want to speak as very little as possible. But thank you for all having me here this evening. My name is Tom Goodridge. I am Public Involvement Manager for West Sussex Clinical Commissioning Group. At least we will be a clinical commissioning group until early next year, when we'll become an integrated care system. And I think with that in mind, it's a really good time to consider how, and as Gulu said, how we change the narrative around as health professionals, around how we change the narrative in terms of talking about of dismissing the hard to reach communities name tag. As Gulu's rightly said, communities or individuals aren't hard to reach. It's about the way in which we message, the way in which we reach out to communities, and the way in which we listen rather than make assumptions. So my role within this, in the lead up to this webinar, has been very small. I've been working with DRI, with Medbrack, Rakia, AXA, Julie, and others in the organisation, and already they have provided a lot of personal challenge and reflection for me in terms of how I, as a practitioner, reach out with different communities, different individuals across West Sussex, and I've been really refreshed by DRI's approach to the brief that I gave them as a public involvement manager within the clinical commissioning group. Our role within public involvement, our team has been slightly, let's say, focused on COVID and the vaccine uptake. But what we are seeing with that is that we are having to adjust, adapt, and work differently with our communities than we ever have done before. It would have been fantastic to have this in person, but obviously we're online today. And what we have seen come through very loudly and clearly, front and centre, are health inequalities on a daily, if not hourly basis. And you don't have to be working within West Sussex County Council or the local clinical commissioning group to see that and feel that and experience that firsthand. So my focus as well is I've also been in recent weeks concerned around fatigue for communities, around vaccine uptake, around being asked questions and then not hearing things, hearing the impact of individuals' responses. And one thing I want to promise tonight from myself is that recommendations, questions that may come my way as a representative of the CCG will be followed up. So I will put my email address in the chat bar shortly, and I will follow up on those individual queries, questions, challenges, and yeah, I feel the work that has been done by DRI is absolutely fantastic. And as I said, my frustration has been that fantastic projects end with recommendations that aren't fulfilled, or fantastic work goes in, and then those that were asked to spare their time, spare their experience, spare their knowledge, share their stories, many of them emotive, that then nothing seems to go any further from their perspective. And that feedback loop, I think, going forward is absolutely crucial. So I am keen to continue that feedback loop well beyond this webinar, with the support of DRI, Gulu, and others in this virtual room. But I will leave that there, and I will pass it back over to the capable hands of Gulu, and I will do as I'm told and turn off my camera and mute my microphone.
Thank you very much, Tom. Thank you very much. Without wasting time, the next guest there, the next speaker there is Parveen. Parveen is going to be giving us a poem I forgot here just to give a brief introduction. Not really for forgetting. I still have the opportunity of actually giving a little bit of introduction, probably just so as not to waste time. Parveen, do you want to just give a little brief about yourself?
Okay.
Yeah.
Okay, yes. I'm part of Diverse Crawley, but I'm also part of different organizations in Crawley. I do a lot of community work across different communities. I was born in Kashmir, brought up in London, and I moved to Crawley a few years ago. So, yeah, that's me.
Thank you. Yeah, go ahead, Parveen, with the poem.
So I've written a poem which is very relevant to what you've said, and it's called Just Ask. I stepped through the glass doors, white walls and blue shining floor was my welcome. Nobody came to me, even though my distress was plain to see. But I wasn't seen as a somebody, as my body grew with the child in me becoming mine. You only saw my scarf and the color of my skin. I walked along the long corridors waiting for a hand to reach me, but no hand came. I had to rescue myself and reach the bed that I so desired. Questions asked, temperature checked, read book given, pillows puffed, but nobody looked me in the eyes. What was I feeling with my first child inside me? I wanted to cry, unsure of what was happening to me. I felt no comfort as white coats treated others with smiles. I was told to be strong. You people are always strong, so be. I didn't want to be. Nobody asked me what I needed or what were my needs. Was it because they didn't see me, or did they see my differences? My baby moved, ready for its arrival. I felt lonely and scared. I didn't know how to explain my pain. My mother tongue was nowhere to be seen. I was hungry, but didn't know what was on my plate. No reassurances, no compliments to my cultural tastes. I felt lost, but the pain was becoming unbearable. My baby was ready, but was I? I was eventually moved. My water was flowing. The bright lights hurt my eyes. I felt my skin tighten and loosen. I needed something, my head said. My screams became my shout for help. Why was no one near? Why was no one easing my pain? Blue uniforms looked and walked by. White coats peered through the door. My baby was making me tear. Ask me how I was feeling. Somebody ask me, just ask me, but nobody did. My baby came skin to skin, tiny but with a shine in her eyes. But I was gone. I looked from above, my child alone. Nobody had seen me, the mother who was invisible. I saw white coats write out their mistakes, but it was too late. I had gone. They held my dark-skinned baby and knew nothing of her roots, but only judged what they wanted to. They had not asked me who I was, what I was, where I had been, and where I wanted my baby to be. I was gone, misunderstood. I should have been in a place safe and looked after, but I was not seen. I wasn't asked, not asked. I wasn't.
Wow. Wow. Thank you very much for the poem. Very, very interesting poem. Very interesting poem. I'm not going to comment much, but there are some words that I've actually picked up there, some descriptors there. There is words like you. There is words like they. There is words like us. There is the stereotypes. There is everything. There is a descriptors that describe a certain type of people. Who is the they? Who is the us? Who is the you? I would leave it there. Probably some discussion points later on. We go on to our next speaker, and that is Jason. Jason is a man of many talents. Just been looking at his resume here. He is definitely a man of talent, a man who's actually worked in so many number of areas, acquired so many qualifications, but I'm not going to be taking that thunder away from Jason. Jason, do you want to just give a little brief description of you, who you are, sir, before you go on to give us your presentation?
Yeah, sure. Thanks, Gulu. So I should say I work part-time in the NHS, so in an early intervention service, and that's the presentation that I'll be delivering today. My other half, I am a researcher, so we're doing a research project at the University of Manchester, where we're looking at the ethnic inequality in severe mental illness, and we're currently writing up papers for that study. So that's been a 2-year study, and I have a number of different hats and involved in a number of different projects. I'm going to try. Okay, so I can't share my screen. The host, if I'm able to share my screen, please. Is that possible? If not, I'll just ad lib and talk through.
Jason, you should be able to share your screen now.
Okay, thank you. Perfect. Okay. Okay, so I just need to get to slideshow. Okay, so yeah, so as we all know, we're here for Diversity Resource International. My name's Jason Grant. So I'm going to talk about an early intervention in psychosis service. So this is the service that I work for, and it's basically to try and demystify what a mental health service does, how people can access support, and what they should expect from a service when they come into it. So psychosis is characterized by hallucinations, delusions, a disturbed relationship with reality, and it's very distressful, and it can be seen as a disability for the person and their family and their carers. I don't know if anyone watches EastEnders, but they do have a recent running story of a young black man who experienced psychosis and had to go into hospital. So that is kind of the mental health situation that I'm describing at the moment. Why is this not moving? Okay, so you can get a diagnosis of schizophrenia, borderline personality disorder, or psychotic depression. And there's some other less common psychotic disorders will usually be made. It can take sometimes months, it can sometimes take years to receive a final diagnosis. And a lot of people that are in our service don't actually have a working diagnosis for us to be taking them on. So treatment begins as soon as possible. So as soon as somebody is taken onto caseload and comes into a service, they don't have to wait for a diagnosis to be treated. And the treatment is usually evidence-based, usually cost-saving, and it's usually preferred by service users and carers over other generic services. So we really give a tailored service dedicated for the people that we're serving. The good news is recovery is possible. So people can, who experience psychosis can and do recover. The time from onset psychosis to provision of evidence-based treatment has a significant influence on the longer term outcomes. So basically, if somebody gets treatment early enough, then they're more likely to have a more positive recovery and no longer need to use kind of secondary mental health services again. So yeah, the sooner treatment is started, the better outcome and the lower overall cost for care for the person. So some of the core aims is to reduce the duration of untreated psychosis, including to support people with an at-risk mental state and to prevent the transition to more long-term psychosis. Secondly, to produce effective outcomes in terms of recovery and relapse rates. What you expect to receive, so adults with a first episode of psychosis start treatment usually within 2 weeks of referral. So we don't have kind of long referral waiting times. Usually within 2 weeks, you start your treatment straight away. Family members are offered family intervention, which is really important. So it's not just the person receiving the care that gets treatment, but also the family members are able to get support as well. Adults with psychosis are offered cognitive behavioral therapy for psychosis. So that's CBT specifically for psychosis. So that's a nice guided intervention. And carers will be receiving carer-focused education and support programs. And this is really important because a lot of the times, a lot of carers do not really understand what's going on for their loved one. Their loved one goes in, has the appointment, and then comes back home again. But it's really, in terms of our service, it's a really important piece is to re-educate the carers and the support around the person as well. So they will obviously receive a comprehensive physical health assessment to ensure that their physical health is as best as it can be. And people are offered a combination of healthy eating, physical activity, and obviously help to stop smoking, which is really critical. Adults with schizophrenia who've not responded adequately to treatment of at least 2 antipsychotic drugs will be offered clozapine. And adults with psychosis schizophrenia who want to find work or return to work will be offered supported employment programs. So yeah, the key message for me really is the NHS is open. So I mean, obviously we've all lived through this kind of horrendous pandemic, but yeah, we are open for business and we are supporting people. We've not stopped working throughout the whole pandemic either. So if you know anyone that's experiencing psychosis or a similar situation, I guess, then do refer in to us because we are open. And the last kind of short one for me is outside of the work I do in the NHS, I'm also a community ambassador. So that's a volunteer where I volunteer for the Sussex Health and Care Partnership and the NHS. And we are currently looking for more diverse people to become volunteers and to become a community ambassador. So if you're interested, what I will do, let me stop sharing. I'll put a link in the chat for some more information. But yeah, if you're interested, yeah, do kind of look into it and sign up because we do need more diverse people, working for and volunteering for the NHS. So that's me, Gulu. Thanks.
Thank you very much, Jason. Thank you very much for the presentation. I think I could have, there is a quick question here for you, Jason. There's a quick question that I've got here. Just take, I wonder how many of those using the service are neurodiverse.
Okay, so in terms of neurodiversity, if somebody has what is called a learning disability or a significant learning difficulty, then they will be referred to a neurodiverse service. So they won't be taken on into our service, just because people have to have some level of cognizance to understand some of the treatment and services that they will have to go through, really. So we did in Sussex Partnership Trust, there is a neurodiverse service for people who won't fit into our category.
Excellent. I will just take one more question, Jason, then I'll take the other two to the Q&A one. This one here is saying, is this service open to those that do not have English as their first language?
Absolutely, yes. We are open to anybody who lives within Sussex. If you don't have English as a first language, you will need to have some sort of translator with you or an interpreter with you. But that's not a barrier. So even if your English is not your first language, you can still be referred into our service and get the support you need.
Okay, probably we'll develop this further. This question is probably as we go on further. Thank you very much, Jason, for your presentation. The next one there is Iyadh on primary care. And again here, this is one gentleman that I've worked with for quite a long time, who has been so many places, county council, CCGs, you name it. But Mr. Iyadh, you would want to introduce yourself, sir.
Thank you very much, Gulu. Could I ask Julie to share my slides, please?
Yes, of course. Just a moment.
While we're waiting, I regard myself as a community volunteer servant since I took early retirement from being a chartered chemical engineer for 30 years. I like to be busy, so I've been involved with various voluntary organizations, and yeah.
Okay.
Thank you.
I'm ready to share. Are you good to go?
Yes, please.
Okay.
Okay. Well, thank you for inviting me. As the title says, it's I'd like to give some reflections on the health and social care services for diverse communities in West Sussex. It comes through the talk, the various things that I've been involved with, but currently I'm chair of the West Sussex CCG and West Sussex County Council Minorities Health and Social Care Group. I'm also a member of the Diverse Crawley Committee and the chair of Crawley Interfaith. Next slide, please. I'm trying to stick to the 10 minutes. What I would like to do is to, introduce the subject and then talk about the system of service provision. To me, relationships, which I'll talk about, is very important, and give some examples of what I think are the barriers to a good service provision. Then say a few words about customer consultations. I've used the word customer because the NHS say patients, that's NHS speak. West Sussex County Council used to say service users, now it's customers. So I'm going to use customer for all of them. And I will share with you some recommendations perhaps we can discuss. Next slide, please. Okay, well, we've been going through a very difficult time, as you all appreciate. No one is safe until everyone's safe. For, to have a healthy society, if someone is not well, say, for example, a train driver, a bus driver, or any member of society, then that service won't be available. So really, the aim should be wellness for everyone. As I said, I'm going to share my experiences, explore ideas, and discuss recommendations. And my experience mainly based on being a volunteer, what I call myself as customers representative in public services, committees, forums, and workshops. I've worked with the NHS and the adult service, and also we're involved with the police service. And after 30 years of being a chartered chemical engineer, well, I lost my job and I didn't want to carry on. So I took early retirement and I started to work for social services. And for the past 20 years, well, I'm not anymore. I worked as a senior support worker with adults with learning difficulties. We took a very large number of people from residential homes to live independently in the community. The other thing which I think we need to focus on is to keep thinking about the customer's journey, and the NHS speak call it patient's pathway, and to put ourselves in their place. Next slide, please. To me, the two main elements of a service provision is the human elements and the system elements. And the human elements include trust, behaviors, prejudice, unconscious bias, and racism. And that is such an important subject, but within 10 minutes, I'm not leaving it out because it's not important, but because it's really, it needs one session, webinar or conference to discuss it. It's always more difficult to deal with the human elements than the system. The other thing is most services are generic. So I think we need to think about a person-tailored or person-centered service. I'll just give you very briefly the history of the formation of the Minorities Health and Social Care Group. I was part of the Crawley CCG during its formation and authorization as a lay member of the board. And then we set up the Patients Forum in it. Also, I used to attend with the BAME customers panel with Ruth Gordon, who was the Development Services Manager of West Sussex County Council. And then she suggested, and then we put the two together, saying combining health and social care. And it was mostly centered around Crawley. And then with the changes happening with the CCG and so on, it's been expanded to cover the whole of West Sussex. And we have meetings once up north of the service, that's before COVID, and now it's all on Zoom or the other system, and once down south. Next slide, please. This is a sort of simplified diagram to show service provision. So the decision makers, for example, the Cabinet Member for Health and Social Care in West Sussex County Council, with the agreement of the Cabinet, West Sussex County Council Cabinet, would agree a budget that would be passed on to the service commissioners, which then would be allocated to frontline service providers who could be either private or public, and then the service provided to the customer. Next slide, please. Now, to me, within that system, the relationships or the relationship between the customer and the service provider is the most important part of it. It's a two-way process. And we always talk about the service provider. But I think, we also need to talk about the customer side. So I feel there is a need for better awareness and education of both partners in this process. And we need a very good channel of communication between them. I mean, when it comes to the commercial sector, they always say the customer comes first or is the most important. And I think we also need specialized communication for customers, taking into account language, their faith, their culture, and so on, to get the messages to be effective. Next slide, please. Very, very briefly, there are many barriers to good services, and we always talk about, the barriers that are to do with the service provider, which I think they're well documented. But from my experience, and Jason in the previous talk covered mental health. I've been involved with with Langley Green Hospital, which is the mental health hospital in Sussex or north of Sussex. And one of the issues that were raised or came about is exactly as Jason said, instead of it escalating, as they call it, to treat people early. One of the factors is stigma of mental health in some of our communities. So that's an area that I think needs to be addressed. The other side with social services, certain communities regard caring for someone is the responsibility of the family. And the issues that we've raised with those communities is that, when the person you're caring for, their needs become complex needs, you might not be able to deal with them. So that's another area. Customers in general, but also more so of the minority communities or diverse communities, they have a lack of understanding of the system. The other thing is, again, low uptake of prevention measures. That is highlighted in quite a number of studies. As for the service provider, most service providers, whether because of capacity or other limitations, provide a generic service, a generic communication and service. And, with some kind of increased capacity or improved, it needs to be more tailored towards the person. And the service providers have limited knowledge of cultural factors. And we as community servants, we've worked with the Croydon Borough Council, the police and other organizations where we've been part of awareness training and workshops where we talked about factors such as faith, or to give them more awareness of factors, cultural and faith factors. Next slide, please. I think you're all familiar with the customer consultations process. Normally what happens, there is a consultation, a report comes up with all the recommendations and so on. But then there is no follow-up to report back to the consulted or the customers. And people say, we've done these consultations and tell us what happened. So we really need to have a new additional step or steps. Ideally, we should have a realistic work plan for implementation coming from the recommendations of the report or the consultation report. And that should be, the outcomes should be reviewed against the work plan with customers so they feel, when they suggested things, they will listen to. And I think customers would accept legitimate reasons because of limitation of resources and other factors. Next slide, please. These are just few recommendations, which is something that perhaps we can consider, and that is we need to establish channel of communication between diverse communities, minority communities, and decision makers. An example of that, the West Sussex County Council Customers Panel, the cabinet member for health and social care group used to attend regularly, which I used to attend that panel, and from memory, a while back, they used to chair that panel. So something similar might be useful. People in general, or customers in general, and also more so of diverse community customers would need a single point of access for information and signposting, providing, it was mentioned, language interpreters. And there is a need to have funding and grants to capacity build minority communities, volunteer groups. So it's like, community self-help, and to provide education opportunities for customers to better understand and negotiate the system. And it applies to all customers, but more so with the communities, so that they can understand, to have open and transparent approach with customers. Next slide, please. Yeah, I would like to finish and would like us to reflect on this final comment and make sure that we please do our best to make it right. As I said, I worked for social services, and a senior social worker I knew with a very long experience said to me, Iyadh, the people who need help the most are the least able to know how to ask for that help. And I hope that we will, do our best to improve on that. Next slide, please. Thank you for your attention.
Yeah, thank you very much, Iyadh. Thank you very much for that insightful presentation. And thank you, Rakia, for not telling me off. I forgot to mute myself, and I've been fluffing up the pages and making all the noises. There is a question for you, Iyadh, but we'll take it at the end. We're just trying to rush time there. And one of the things that we've heard from Iyadh there is the fact that it's not just about minority communities wanting. There is also opportunity for minority communities actually volunteering their services, just like what Iyadh has been doing, volunteering. The county council and other services do have systems in place. It's how we also are proactive in actually exploring those opportunities as BME and minority communities ourselves. I go on to Kiran. Kiran is going to be touching on COVID and its impact.
Hello, everyone. I hope you can hear me. Hi. So my name is Kiran. I am a local councillor here at West Croydon Borough Council. And first, I just want to say thank you for the invitation to come and speak at this event today. And I just want to give an introduction on what I'm going to speak about. So first, I'm going to speak about the vaccine rollout and its impact on BAME people and the uptake on vaccines.
Turn around,
I don't know if I can be bothered. I only live at the other side of the traffic lights.
Yeah, they just said they're going to be 2 hours or so.
There is two people having a conversation. If you could just mute.
Sorry, go ahead.
Yeah, am I okay to continue? Yes. Yeah. So I'm going to start off by just giving you an idea on the vaccine uptake gap, which is still a very important issue that we need to address. So from the age of 80 plus, according to the source of a Public Health Wales, and I will send this in the chat after I have read. And this is data from December 2020 to April 2021. So the age group of 80 plus, there has been a 96.7% uptake from whites, and the BAME uptake has only been 86.8%, so that's a 9.9% difference. And from the 75 to 97 age group, there's been 93%, 96.3% uptake from whites, and 85.3% uptake from BAME. So that's an 11% difference of uptake on the vaccine, and from 70%. And from 70 to 74 age group, there's been 96% uptake from whites, and 85.4% uptake from BAME. So that's a 10.6% difference. And from the 65 to 69 age group, that has been a 94.5% uptake from whites, and in BAME it's 83.1%, so that's 11.4% difference in the two groups. And for the 60 to 64, there's been 92% 0.2% uptake from white, and 81.3% uptake from BAME. So that's again a really large difference of a 10.9%. And the last two groups that I have data on is from the 55 to 59 age group uptake. There's been a 89% uptake from whites, and a 77% uptake from BAME. So that's a 12% difference. And then the last age group that I was able to find data from when I was doing research for this is the 50 to 54 age group, and there's been a 71%. There has been a 74.1% uptake from white, and a 68.2% uptake from BAME, and that's a 5.9% difference. So as you can see, there is a massive difference in the uptake on vaccines. And I really think it should be our duty as a community to be able to tackle this, and that is what we should be working on. And then when it comes to healthcare in general, and I think this kind of leads on to why BAME people are not taking up the vaccine at the same rate as their white counterparts. Not that they aren't taking up the vaccine, but they aren't taking it at the same rate as their white counterparts. And the reason why I believe this is because there has been a history of health inequalities between BAME and white communities, and it's important for us to campaign on how to improve access to primary care. And I think it's up to health services across this country and across the world to basically understand the differences between the disparities, and it's important to examine and recognise the increasing diverse population of the UK, and it is important that we need to be understanding the population at a community level and the challenges faced by the BAME community, and the NHS is obviously responsible for commissioning high quality primary care services for the population, and it's hugely important that those services are accessed at the same level for BAME people than it is for their white counterparts. And I also believe that language plays a huge role in patient access, especially if English is your second language here in the UK, and therefore it is not surprising that I believe that language barriers has been reported as a dominant factor of affecting access to healthcare. And I believe that's been more prominent during the pandemic, because during the pandemic, when you're not advised to go to the surgery and to go to hospitals in like packs, and you're not allowed to like have your children there to translate for you, or have like relatives there to translate for you because of the pandemic situation. It is important that we campaign for that. And I also believe that culture is another aspect on the health inequalities that is really important here. And this is the last point that I'll touch on, because I'm aware that we have a lot of other speakers to come today. So the culture aspects of health inequalities, I feel like we do have to consider how a patient understands their diagnosis, their beliefs, and about their health in general, and their views and knowledge of healthcare, and how their religious beliefs might play a role in their interactions and their access to healthcare. And I believe that systems that should be put in place for healthcare providers to recognise these potential barriers and provide policies to tackle them. Cultural competence, education training and programs have been a topic of discussion to have and to an extent proven beneficial. However, current research appears to be of low quality, and the data is insignificant in most of the studies that I have seen, and it is clear that further research is definitely required into the culture aspect of health inequalities here in the UK. So I guess I'll stop there, and again, thank you for having me on, and I'll be happy to answer any questions at the end. So yeah, thank you.
Thank you very much, Kiran. Thank you very much. There is a question waiting for you at the end of the session, in the Q&A session there. Thank you very much for that presentation. I think what we are hearing there is these disparities, and it's not as if the services don't know about the disparities. They do know. The services are trying to understand how best they could actually engage with the BAME and minority communities. One point that was raised there by Iyadh is around capacity building within the minority communities themselves. So if there are cultural issues, if there are religious issues, how best can we actually utilize the asset? And that asset is the community itself that actually understand the people that live within that community, how they talk to them, the understanding their culture and all the other stuff. Something to be discussed at a later stage. We go on there to Jelani. Jelani is going to be giving us his take on the refugee barriers, him himself being a refugee. Jelani, if you could just go ahead.
Hello, good evening. Sorry, I don't know if you can see me.
You might want to switch on the camera.
Yeah, I don't know, it says your camera is not launching properly. Can I just stop like that, because it's not allowing me to turn on my camera?
Go ahead, sir.
Yeah, thank you for having me this evening. My name is Jelani Abdu, and I'm a caregiver in West Sussex, and I'm also a captain of a refugee football team in West Sussex called Nations United. And today I'm going to talk about 3 key points. They are access to information, relationships with GP, and funding for community engagement. So when we come to access to information, as a young person, the language barrier has a huge impact. Understanding the information, like important information. And also because of the language barrier, the relationships, sorry. Can you hear me still?
Yeah.
Yeah, okay. Yeah, because of the language barrier, we have a lack of trust with professionals also, and lack of relationships with GP, such as unaware of GPs, doctors' names and references. as a young person, I've lived in West Sussex for 5 years, and I still don't know my references and my doctor. And this is because I think when I came to the UK, and the information I have been given was in English, and I didn't understand since. And I think because of that, I still don't know my references and my doctor's name. And I got different doctors when I go to my my doctors the hospital. And also so we have there's also good things as a young person I've seen in West Sussex. And we have a football team in West Sussex, a refugee football team, and that football team makes a lot of good things for young people. For instance, if they arrived like 2 weeks ago, a week ago, they still can make friends from coming to football team. And they also providing themselves from being lonely and mental health problems. And if you just came to the country and you make some friends, I think that Justin also he was talking about sooner treatment. So which Nations United also plays this role, I think, I see a lot of things as a captain of football team. And we also have a lack of trust with professionals, such as like with the PAs or social workers. This is also because of the language barriers. You also have we only have translators or interpreters when the social workers needs in a specific time or specific meetings. We didn't have any translators at the beginning. So when your social worker wants to meet you, they just come to you and they make a meeting with you, and you just left without understanding anything. This is a huge impact this is a huge impact that we didn't understand so many informations as the young people. And sorry. Oh, I would say like if West Sussex County Council or any council, because it's when you come as a young person to this country or as a macho, it's completely different. When you come as a young person, you came across a lot of different things on your journey, and you wanted something, you expected something in here, and because you missed that chance because of the language. And when people comes to England or to the UK, if we would have leaflets translated in our language, that would have been really helpful for our young people. I think that's it for today. Sorry, I don't know. I'm going to step in. I think if you want to ask me some questions here, I can answer them at the end as well. Sorry.
Excellent. Thank you very much, Jelani. Thank you very much. I think we will wait for the Q&A session. If people have got questions for you, we'll try and raise them then. Thank you very much for sharing your experiences. That there is a perspective from the young people and young people arriving in this country, trying to settle in this country, and some of the challenges that they have to come across. Then we go on to our next speaker, and our next speaker there is Percival. Percival is also a younger person or young person who's arrived in this country as well and would like to share his experiences as well.
Thank you. Can you hear me? Yeah.
Yeah.
Every pen has a story to tell. A piece of paper is just a reflection of our lives. My name is Percival Tussamba, and this is my story. I am from Angola, a country located in southwestern Africa, a country rich in arable lands and natural resources. And despite from its riches, Angola still remains a poor country as a result of a bad and dirty policies and, of course, corruption, which has affected even the dogs on the streets. But let's not go there, and allow me to start again. Gatwick Airport, October 2017. Like a dead bird flying through a broken sky, I found myself flapping my weak wings in search for a nest. I found refuge and I asked for help. Despite being treated well by the police, I never felt comfortable around them. This is because of the things I've witnessed from the police in my own country. For first 6 months, it was hard to cope. I could not understand the language, and people used to speak very fast. So I tend to keep quiet most of the time and just wandering around the town. I felt welcome. I felt just like anyone else in town until I had my first moment of the stranger in town syndrome. I was stopped by the police just for walking around, or as they described, I was a matter out of place. How could this happen? After starting to trust them, the police, I was confused and disappointed, but I did not take it personally. They were just doing their job. I had to learn how to live in the white man's world, and it took me a while to realize that was black. Hold on, not by pigmentation, of course, but by the stereotypes. Being able to reverse the nightmares into dreams, creating new bonds by making friends, and finding my passion was the way for a new start. As Lord Iyadh Daoud once told me, be less conscious of your limits. From here, I started believing me and drove myself into a new culture. I joined a local boxing club, Oakley ABC, which helped me with my mental and physical health. Everyone received me with an open heart and smiling face. Now we are like a family. I've been a Hummingbird Young Leader for almost a year now, and I've been learning so much from public speaking, communication, politics, advocacy, and leadership. Through my learnings with the Hummingbird Project, I've started a YouTube channel called Ntangu Yamalonge. The name comes from Kikongo language, a language spoken mostly in the north part of Angola, and it means educational news. On my channel, I share any interesting facts and lessons from science to history. My goal as a young leader and a video maker is to reach as many people as possible, to change minds and do all I can to help others. I just finished college, where I was studying engineering and science. I hope to join university in September and start biomedical engineering. So today, I want you to think about how you can make the lives of other young people arriving in the UK easier and less challenging. Here are 3 things you can do right away. Number 1, be more open-minded and less judgmental. The life of many refugees around the world is still seen in black and white, just like the pen in this paper. The media has played a huge role in the way society sees asylum seekers and refugees, much of which increases discrimination, racism, and Islamophobia. Integration and acceptance are deeply connected, and one cannot succeed without the other. As we have learned so clearly with Black Lives Matter, resolving discrimination is everybody's job, not just a job of the oppressed. And by the way, there's no such thing as a legal refugee. I guess we'll have to remind this to Priti Patel. But anyways, number 2, offer communication and trust. Communication is a key for a good relationship, and with him comes trust. And most of young people found hard to open up in the first couple of weeks and months because of lack of trust. Partly because it can be very hard to find people to place your trust in when you are leaving your home and traveling along to a place of safety. So when you meet a young people or a young person for the first time who are new in the country, it's important to not rush and let them take time to build up trust. Number 3, volunteering your time and skills. When asylum seekers and young refugees arrive in the country, they often go through a long wait. This increases loads of doubt, anxiety, and fear. As a result, most of us stay stuck at home and with nothing to do. You can help a young person to integrate into a new culture by volunteering yourself to organization in your community where you can teach, coach, or share your knowledge and experience. Everyone wins. Before I go, I want to share with you my definition of community, what it means to me. Community is a place where we are able to exert and put in practice our leadership skills, create an environment where people should be treated equally and with dignity. And when adversity comes, we are able to stand shoulder to shoulder to overcome any problem. Thank you so much for listening to me. If you have any question or doubts, don't hesitate to put in the comments or chat. Thank you.
Wow, that's an excellent piece, sir. I will book an appointment for me and you and the Prime Minister just to discuss what community is. I think he probably would understand far much better from you. That's an excellent piece. What I'm hearing from the young man here is don't judge the book by its cover. What I'm hearing from him here is we are who we are because of the experiences that we have had. There are times when we don't trust people, not because there's anything wrong about them, but because we are carrying a baggage. There's things that have actually informed us right from where we actually come from. Listen to him here having been received by the police, being nice, everybody being nice to him, but still couldn't find any trust because of where he's actually come from. So be open-minded. This is what we're actually hearing. We have got questions for you, Percival, at the end of this session. Don't go away. And thank you very much for that. And then we go on to our next speaker, and we reserve the best, or it is the last coming in with the best. And that there is Marilyn. Marilyn, do you want to introduce yourself and then give us your take?
Well, thank you so much for inviting me here and listening to all those presentations. I mean, following Percy is a great challenge. My presentation ties in nicely with Parveen's poem, but my name is Marilyn de Feuvre. I am co-founder and chair of Diverse Crawley. I have been volunteering in Crawley for the last 25 years. But I also have a strong medical background. I'm a retired podiatrist, midwife, and an RGN. I am going to talk about the BAME maternity scandal. Next slide, please. I've started with a beautiful photo of a very happy looking mom and a beautiful baby the joy of a newborn baby. Next slide, please. And I could relate to that photo because recently we had a personal family baby in our midst. My niece had several miscarriages in the recent years, but she had some milestones of pregnancy during the pandemic. And we celebrated her first scan virtually, of course. We had a Zoom gender reveal. We had a Zoom baby shower. Baby was born at full term on 4th of May, 2021. And we celebrated again virtually an outdooring, which is a baby reveal. And it's because her partner is from Ghana. So we all dress in white because it's a Ghanaian tradition to celebrate that mother and baby have survived childbirth and the neonatal period. Very important that. Next slide, please. I'm going to start with a few definitions. Maternity care refers to the health services provided to women, babies, and families throughout the whole pregnancy, during labor and birth, and after birth for up to 6 weeks. A stillbirth is a baby that dies after 24 weeks of pregnancy. A neonatal death is a death of a baby who is born alive, but sadly dies within 4 weeks of birth. And BAME, I'm sure you know by now, Black, Asian, and ethnic minorities. Next slide, please. So what is the importance of maternity care? Just generally, it's for the health of women and children. Routine early prenatal care improves health outcomes of women by identifying treatable complications such as gestational diabetes, preeclampsia, and ectopic pregnancies, as well as others. The likely problems if there's no prenatal care are that babies are 3 times more likely to have a low birth weight, 5 times more likely to die than those of mothers who do get care, 7 times more likely to have preterm births with all its complications. All this leads to higher costs passed down to you and I, a taxpayer. So it's very, very important. Next slide, please. So what is good maternity care? We have the pre-pregnancy state. You actually need to be of good nutrition and health. You need to live in a good house. You need to have a reasonable occupation, etc., etc. Prenatal care is you need a consistent midwife for good rapport and relationship to develop. During labor, you need trained assistance, especially pain management. And I will put that in emphasis because there is this misconception that we have higher pain thresholds, etc. And I will talk about that. So you can see from the photos there, there's the gas and air, there's the epidural, all things that you can plan for during before you give birth. Next slide, please. So this is where we're going now to the some bad statistics. The BAME statistics is that in 2011, the UK census, 14% of the population identified as BAME. Ethnic minorities are among the most disadvantaged in various social determinants of health, including unemployment, poverty, inadequate housing, social exclusion, lower levels of educational attainment, and the list goes on. BAME women have significantly higher morbidity and mortality rates in the UK, as well as poorer experiences of care, which you can't quantify. But the experience of care is very, very poor. According to Knight et al. In 2019, Black women are 5 times more likely, mixed ethnicity women are 3 times more likely, Asian women are 2 times more likely to die than white women in pregnancy. These are staggering statistics, people that die just because of their skin color. Next slide, please. More statistics, the stillbirth rates are not any better. 1 in 295 white babies, 1 in 188 Asian babies, 1 in 136 Black babies. So that's twice more, again, because of the color of your skin. The infant mortality rates in UK 3.583 deaths per 1,000 live births, and with the BAME, 6.4 deaths per 1,000 live births, twice more again. You can see a pattern here. Next slide, please. So SANS is the Stillborn and Neonatal Deaths Charity, and Cllr Harmer in her recent National Maternity Report, which was published recently in The Guardian in July 2021, said, babies should not be at a higher risk of death simply because of their parents' postcode, ethnicity, or income. That's very powerful. Next slide, please. I now just want to touch on the BAME mothers' maternity experiences. Remember, I talked about the poorer care that we get, the experience of care that we get. And for this, I watched Rochelle Humes in the Dispatches documentary, The Black Maternity Scandal. And there were real life stories there by several women. And I just picked on a few. Naomi Venter, whose sister died of complications of childbirth and was now tirelessly campaigning to lower the BAME women death rate. Another example is Sandra Igwa. She felt the disparities of her treatment. She was ignored, she was not listened to, she was dismissed, she was traumatized. She experienced the daily institutionalized racism, contrary to Tony Sewell's recent findings in a government report stating that systemic racism does not exist. She is now a founder of the Motherhood Group. I also found Kelechi Okofo, a dancer who gave birth in 2019 and is now raising awareness and does not mind being called the angry Black woman, which is what she was labeled, because like Shamika Dockery, her pain was classed as exaggerated, hysterical, that she had an attitude, etc. The list goes on. Next slide, please. So this gives you just we only have 10 minutes, we could really go into this. I want to start off with a no to the following recommendation. I saw a petition yesterday which says that they are trying to increase induced labor for all BAME mothers to solve the problem. It's a definite no, because induction has its own problems. So we should only be induced if the criteria suits that. But the positive recommendations that I have here are the level of commitment of introducing targets with deadline dates must be taken seriously. There should be a scheme of continuity of care for the same midwife and team throughout pregnancy for that rapport and relationship to develop that I talked about earlier. We should tackle the reasons for the death rates. There should be no cover-ups and a no blame culture. In July 2020, the Health Inequalities Task Force was asked to focus on reducing adverse health outcomes experienced by BAME women and implicit racial bias experienced by healthcare workers. So we see that something small is happening. But I also have one recommendation that I thought of today. We should engage with our local maternity hospitals to reduce the local, the ratio. This is something that I've been doing with my other hat, Crawley Campaign Against Racism, where I engage with the local police to try and reduce the stop and search ratio that is 10-1. So the last page, sorry, I think, am I okay for time? My last page is that we need action now to save lives. The task force says the time to act is now. And it should start mainly by listening, but then it should move from conversation to action to save BAME lives. Thank you so much for inviting me here.
Absolutely wonderful stuff. Thank you very much, Marilyn, for the well thought out presentation, challenging, and I'm hoping here that services here, there's lots of my colleagues, there's lots of partners from different walks of life, from different services who are actually listening. And as much as they've been listening to everyone here today who's actually made that presentation, and I know they'll be taking away some of the stuff or all the stuff that they've actually heard from here. One of the things that I have heard in some of some meetings that I have attended is is how some people, when they hear stuff like this being put out there, coming from directly from, say, from the BME or from any other groups, or whether it's women talking about equal pay and all the other stuff. There are some individuals, there's some groups that feel as if they're actually being attacked. No, they're not being attacked. This is individuals, this is groups, this is communities living their experience and telling their experience as it is. All we can do is listen. Listen with an open mind, listen with the view of actually engaging in discussions and actually trying to find a solution. What is being said here today should not be taken as an insult or as challenging or whatever it is. It is actually just stating things as they are, the life experiences of those on the receiving end. And thank you very much for that. And of course, we've heard from Marilyn there. There's lots of initiatives actually happening there. There's lots of volunteering work that is actually being carried out. And some of the words, the disturbing words as well that we know are assigned to BME and minority communities. Women probably will say the same. Disabled individuals will say the same. There are some words that are used to describe certain groups of people. We do have a tolerance for pain, really. That's a challenge. Anyway, we are now going to the Q&A session. And thank you very much for all the wonderful presentations that have actually taken place here. All of them were exceptional. I'm hoping now we go on to that discussion session where it is now open to everyone. Please, 85 people that are in here, don't be scared of actually raising your point. Don't be afraid. It's all starts with a discussion. It all starts with a conversation, and then we go on to explore. Now we are getting to the conversation level. Do I have the questions? Am I being helped here with the questions, or do I go straight into the questions? Where are the moderators? Is there any?
There's a live question from Judy, and then we have the questions that have been previously asked as well.
Okay, I do have some that has been posted to me as well. I'll pick up some of the questions. Is there a question to Judy that you is it on the posting? Is it?
Judy, if you want to ask your question now.
Yeah, thank you. I joined the meeting late, so apologies if something was said in the first 15 minutes that countered what I'm saying, but it felt very much like there was an elephant in the room, that we're being told how to access services, but not looking at the reasons why people don't want to access services. And I think Marilyn has just given us a prime example, which was on my list of things to look at. We're acting as if Black people did not come into this country and build the NHS, so have been working in it since 1948. So if we're not using the services, it's because there's something going on about how the services treat us, which we've seen as workers and the children of workers, that actually is a barrier. I've shared in the post Mimosa Midwives Group, which is it's a Black midwives group, which an organisation I'm involved in, took to the UN in 2016 to talk about maternity deaths and the impact on children, where the trauma of childbirth and how Black women are treated can mean the children end up later in life with mental health issues that are not addressed. We've got Sir Peter Bottomley interested because we took the same questions to a Lobby of Parliament a couple of weeks ago. What I'm hearing in this session is talking about ethnic groups, but not distinguishing the differences between the ethnic groups. So apart from the maternity deaths, I don't know if the assumption about some being able to handle pain is specific to some groups and not others, and whether that's actually been acknowledged and understood. I'm not hearing how impact of cases like Dalian Atkinson or Kevin Clark, who are mental health service users who were killed in police, well, who died in police custody because of their treatment. And Roger Sylvester's case going back to 1999, and I don't think that was the first, a black man with mental health issues dying because of how the services treated them, and how that impacts then on people not wanting to refer their relatives or themselves to a service. If they're terrified, they could actually die as a result of it. And a final point is, it's a lot of internal stuff, but where's the outreach? Where's the going and talking to organizations in the community, working with the community members, so that they are reassured that the services genuinely are providing for everybody and want to provide for everybody, so that it's easier for us working in the community to try and persuade people to actually take the risk of going and joining a service, raising their health issues, thinking that they actually might get a decent hearing and a decent service at the end of it.
Thank you very much, Judy. I don't know whether there will be some people that would want to have one or two issues or things to raise with what Judy has already raised there. If there are some people who have got one or two points that they would want to raise in relation to what Judy is actually saying. One of the things that I probably would provide myself in terms of the commentary is definitely, you're quite right, Judy. So much hasn't actually been touched on. I don't know whether it is because individuals here who are the guest speakers probably were focusing on certain pieces that they had the expertise in, and like you are raising here, there's quite a number of issues that have not been raised by this session or within this session that probably need looking into. Maybe that opens up the debate again to say we need more of these sessions going forward, because there is so much that needs to be understood. Anyone with any contribution? And please, if you want to make a contribution, remember to unmute yourself and then put forward your view. Anyone? Do we have the hands up system here on this Zoom thing?
Yep, Boba has another question, and if any of the speakers, if you would like to kind of respond to anything, please do so.
Yeah. Can I come in?
Go ahead, please.
Yeah, thank you. I'm Boba Angelo. I'm from Patient Public Engagement Manager at Surrey and Sussex Cancer Alliance. So we are an NHS organization, and I just was reflecting really on really interesting presentations tonight, and I found each of them really very powerful, and topics discussed and issues raised. It's something that we are hearing, I think, very often today. And one of them that was really highlighted by Jelani is related to communication and lack of understanding how the system works, how healthcare services and other services works, and how and the quality of information actually in how to access the services. So the key of that really is, I'm fairly new in Surrey and Sussex. I'm since September last year, and I made links with some organizations in Sussex, in Crawley particularly. But really, I mean, I really would like to raise awareness, and to link up with the communities and community groups to let them know that they can get involved, that they can become our champions. We have cancer champions. We have 21 cancer champions. And we have some people from BAME communities, from different communities, but we would like to have them more. And the only way that they can actually, that we can hear what they say is really to become our champions, to join our cancer champions. So I really would encourage, and my question is, apart from looking to recruit more champions for our alliance, people who are their volunteers, people who've been receiving treatment for cancer, carers, or maybe patients who've been previously receiving treatment, or previous carers, or general members of the public who have interest in improving cancer services. I think it's really, really important to hear from communities. I don't like to call them, as you said, Gulu, as you said, hard to reach. They are not hard to reach. You just need to talk to them and explain how they can get involved and what their role is going to be. So I am very passionate about having an open and transparent way of engaging with our communities. So I really would like to, and my question is really, as I put in a chat box there, you know, Iyadh really kindly, I've been in touch with Iyadh, and we had a meeting, and, you know, we do have, as you probably know, we do have our cancer campaigns. Each month there is a different cancer campaign, and we need to raise awareness, you know, about screening, for example, to raise uptake of screening, to have an early diagnosis, to get people to get checked early, you know, to go to see their GP if they have signs and symptoms, and if they have reason for it. I mean, Jelani was talking about registration with the GP and issues related to a registration. You know, that is something that, you know, when you get involved in different projects, in different work, you know, not just with our organization, but with NHS as a whole, with hospitals, with the, you know, GPs. GPs have their patient participation groups. A lot of people don't know about them, you know, and that is something that we really, my question is here, Gulu, what would be, I mean, we have our community connections, which is a list of community groups in Surrey and Sussex. And we really would like to have from the council, the colleagues, apart from Iyadh, who is really helpful. And thank you very much for that, Iyadh, supporting our work and our campaigns. Who would be our main contacts, you know, that we can send these messages, that we can let them know, you know, what engagement opportunities are, you know, what campaigns are, what issues are. We do send these messages, you know, from time to time. And I really would appreciate, Gulu, if you could advise, you know, who would be from your communications and engagement team, possibly, who work with the community partnership, you know, who would be for us that we need to have as a contact. That would be really helpful, because, you know, the key here is really reaching those communities and get them involved. You know, currently we have really good project on rehabilitation and rehabilitation services. So that is preparing cancer patients before they start their treatment, and also ensuring that they have rehabilitation after the treatment. So we had a focus group, for example, with our cancer champions, and they told us, you know, what is important for them, what they would like to see, you know, before cancer patients start their treatment, and after and during the treatment. So only with discussion, we are just developing this now, you know, person specification for the service. And that is the early stage. So we need to hear from people who are experiencing, you know, issues like Jelani, like excellent presentation from Percival, you know, and other colleagues. And we need to hear from them.
Excellent. Yeah, thank you very much for that one. I want to have a go at trying to answer this. Is there anyone out of my colleagues? I know there's lots of colleagues here, probably from public health, from the districts and boroughs, from the from health, and from the CVSEs. Is there anyone who would want to have a go? I know what I would want to say, but I'm thinking probably there might be one or two that would want to say something. Anyone that would want to unmute themselves and give us a shout? All right, let me have a go. You're quite right that to ask.
Boba. My name is Boba.
Boba, yes.
Boba. Yes.
You are raising quite pertinent issues there. And I think from my point of view, and one of the things that I'm actually trying to explore now, probably will be given the chance by my director and my manager, is to try and have a go at our collaborative working. Because your question here actually coming to me, when I look at how we are working at the moment as services, I probably would point you now to the community champions that the districts and boroughs are running in partnership with the likes of Citizen Advice and other partners. I would probably point you, say, take for instance, in areas like Aaron, there's the VAC, Voluntary Action Chichester and Aaron. I would point you out to the likes of MISVA in Mid Sussex. There is the public health colleagues, there is the districts and boroughs, but then we are all firing from very, very different cylinders. In as much as the county council and the district and borough councils are probably not working in collaboration. Well, they are, but it's not an effective collaboration with our health and partners like that. So I wish I could actually say go straight to, but at the moment I find probably I would need to have a look at that.
Of course.
I don't know whether the likes of Iyadh, I know Crawley has a different setup and Crawley has got structures in place. They might be able to provide a little answer. This is why I was thinking, is there anyone out there to try and help out? But I think it's more around our collaborative approaches, if I may say.
Yeah.
And I need to come back. I'm actually planning, with the support of my manager, actually bringing together partners and look at our collaborative approaches.
I would be very much interesting to get involved in your work in terms of collaboration, because I think collaboration is the only way forward, really, to be honest.
Yeah. Anyone wanting to have a go before we go on to the next question? I realize we've got only a few minutes left. 10 minutes. And
Tom and Samantha.
Okay.
Samantha, you go first. I think Iyadh had his hand up as well, just as a head.
Oh, I just wanted to say that VAC are very much trying to do exactly what you've just said, Gulu, and it's been really interesting to hear the speakers tonight, because everything that's been said should be pushed forward, and there's some shocking statistics out there, and we've been trying very hard, given the demographic in Arran and Chichester, to try and find the groups and to support them. So if you have any questions, you'd like to get in contact with us, that's what we're here for. We have no barriers, honestly, we're trying our best here. So come and talk to us. And I think I've put the details in the chat very early on. So it's vaac.org.uk, and a lot of the CVSs are trying to do the same thing. So come and chat with us. And we'd really like to hear about the football team as well, because sport is definitely a way in for the young people to integrate, and it really helps with the language barrier. And I know that because I have a lovely friend who's part of one of the groups. So take care. Right, over to you, Tom.
Thank you very much. Yeah, it's a very good point. Sport, food, there's lots of hooks, aren't there, in terms of engagement. I think talking about engagement and working within the NHS, often we come in with an agenda, and it can be put onto communities or a certain way of thinking. And I think going forwards, post-COVID into recovery, is being open to scrap that plan that you had, going to an event on the day saying we want to discuss these things, and having conversations with Mabrak and Rakir and AXA and everything is actually allowing the conversation to go beyond health. From my perspective, if it goes to housing, so be it. If keep the conversation going and building trust with communities, and if the conversation about community ambassadors may have to wait till next time or the time after that, so be it. And I think sometimes it's a bit of it is time intensive, but absolutely crucial. So I would say and I think particularly our VCSs do it so well, is adapting their own agendas going into meeting with community members and individuals for the first time, is actually they sense that actually now is not the time maybe to bring certain things up or to scope things out, but to listen to what the needs of those individuals are at that moment in time. So that was all I would really reflect on, things in the chat, but also the presentations. That's all from me.
Okay, thank you very much, Tom. And there was a question from Mabrak. Mabrak, are you there? Can you hear me?
I think what I have put my question, where do we start, in particular in West Sussex. I know West Sussex myself from the late 1998. What I want to say is, if organizations, whether CCG or local authority or any organization, think that by having one ambassador, they are engaging with all the ethnic minorities, that is just not good enough. So we need to make sure that accountable community organization led by ethnic minority themselves are properly supported, whether it's in Brighton and Hove, East Sussex or West Sussex. Accountability of those organizations has to be on the strategic. And I think what I want to call today at this meeting is, those organizations have to have something in their strategy, in their policy, supported by resources. Then in return, accountability of engagement by those organizations. If there is a cancer awareness, one ambassador is not going to solve the problem. If there is a consultation of CCG, one ambassador would not be able to reach the whole communities. So we need an umbrella organization who is accountable but supported properly. So I think that is what we miss probably in the area of West Sussex or East Sussex. I mean, there are people that know much better than me, maybe locally in those areas. But I am in East Sussex and I know very much about West Sussex. And I think for the last 25 years, we are just absolutely crying for an organization, strong organizations that where they bring all our professional, our experience, our stories, like the young generation are bringing together, but that has to be supported. You cannot just ask ethnic minority who are working in a very low paid job to be volunteers. That's not fair. We need to have opportunities. We need to have a good job. People do volunteering with pleasure when they have food on their table. It's as simple as that. So I think, organizations, and there are lots of leaders in this webinar, we need to get our policies, our strategies to be meaningful, and then, we can come down to practicalities and how we do it. So thank you very much.
Yeah, thank you very much for your contribution there. Just to briefly respond. There is a BME disparities program that is led by Tanya Griffiths-Brown, or Brown Griffiths. That is actually thinking as well around opportunities for BME, like you were saying, whether it's in the workplace or developing those that are already existing within the workplace. It's looking at the organizations as well in terms of their structure, in terms of how they recruit. Are they recruiting enough BME? There are some local authorities, there are some bodies or organizations that are still lagging behind, but there are some that are now very, very proactive, especially as a result of the COVID. Because one of the things that was actually discovered within COVID was the fact that it's not just health inequalities, it's so many other inequalities. And some of them are lack of opportunity, some of them are lack of development, some of them are low paid jobs, poverty, and all the other stuff. So it's actually addressing all those issues, and you are definitely quite right. But then at the same time, I would want to try and encourage as many BME, including myself, to take up the volunteering opportunities, because we also owe it to ourselves in actually improving that particular area. Let us put our own stamp in those areas, because if we don't volunteer, we are still having people that don't understand our culture, don't understand our language, don't understand so many other things volunteering, and we are not taking up that space. But you're quite right. For us to volunteer, we should be able to leave our jobs because we have made enough money within those higher, not high-paying jobs, but jobs that can actually satisfy our needs. And then we've got time to volunteer. Otherwise, we are hopping from one job to another. I definitely get your point.
Thank you.
Any other viewpoint? There was a question, Jason, earlier on, if Jason is still around, about interpreters. I think there was a question that was asked whether within the health there was, I think Jason probably had actually said there are no interpreters within the service that they provide. And it was, please, can you clarify the issue of interpreters for their patients? Jason, are you around?
Thanks, Gulu. Yeah, I must have been, I must have said it wrong. So we, as a service, if somebody needs an interpreter, we would book the interpreter for that person. So anybody that needs an interpreter will have an interpretation service for them. Obviously, because we, in our service, we don't provide that ourselves. So we would have to use a local provider to provide that interpreting service.
Yeah, thanks a lot. Thank you very much. Any other questions that are being raised somewhere? I'll take 2 questions and then we'll come to a close.
I think Iyadh had a question.
Iyadh, sir.
Sorry, can you hear me?
Yes, sir.
It wasn't a question. It's related to having an umbrella organization. Like in Crawley, we had Crawley Ethnic Minority Partnership, which was an umbrella organization for all the community groups. And the funding then was from Lottery Fund. Yeah, so I mean, there is a need to have, whether it's in Crawley or in West Sussex, an umbrella organ, and the funding disappeared. And there are various initiatives within the community development teams of each council, whether it's Borough Council or Mid Sussex, and also with the Crawley Community Action, which used to be Crawley Community and Volunteer Services. There are projects which are funded to work with minority communities. So it is a bit fragmented. The other thing is, which minority communities or diverse communities say, is that, when there is an issue, they get messages. I mean, it's farmed out to various groups. So Citizens Advice has been doing work in Crawley. The council itself has got another group, and so on. So the statutory organizations need to work together on an issue so that the people, they're trying to reach will be getting one message or from one group. Really, that's all I wanted to say. But I mean, the baseline is everybody's trying to do their best, but it needs to be coordinated. It needs to have some kind of, it's been said to me, even within Crawley Borough Council, the community development team, they get asked to go and consult with the minority communities or the diverse communities on issue A, housing, or another issue B. And instead of it being all put together in one sort of survey, they have to do it. There is not even coordination between the departments within. This is not confidential. I mean, it's because they work in different areas and so on. So someone needs to A, simplify the system, and B, coordinate it. Thank you.
Okay, thank you very much, Iyadh. I think it's self-explanatory what you've said there. And the last question I'm going to take, and I do apologize to so many other questions that have been posted here, but unfortunately time hasn't been on our side. There's Stephanie Mooney here that has got a question. Steph, you are the last one to ask.
Thank you for squeezing me in. Firstly, a big thanks to DRI and for Gulu. I don't know how long I've been waiting for something in West Sussex. I think from the experience of trying to host and have conversations with different communities, I think or feel that there is very much a difference between East and West Sussex. And I also want to pick up some point that Judy had raised in terms of that from the communities who are talking to us now feel very much that things haven't changed. In some cases, talking about increasing barriers. It's very difficult for us to share some of the feedback that we've had, and I think it is right that we need to look at, you know, specific needs for different communities, because how they access services, how they want to access services are very different in some cases, and also have some very specific needs. We've very much been trying to approach our research for interest in what are people really caring about? What are the things that people do want to engage with? And I've just seen stuff about voluntary opportunities. Actually, in Arran and Chichester, it's actually very difficult to find placements for people from diverse communities to actually place them with organisations. So I think there is real challenges, and I think my big question is what next, and where do we go from here? So trying to kind of seek collaboration with organisations to really help us to take forward has been incredibly difficult, and it's, you know, we really do need, and I know Mubarak, you said that before, that we need to collaborate, but how can we really try and do something that's tangible and meaningful that actually really starts to change the system? You know, we need to do justice for those people who really, you know, are raising those issues. And I think Iyadh made the point is, you know, the people who really need the services, or, you know, can't access the service, and the people who've actually engaged with us, or particularly in the research, who are people who've gone over and above to get the services that they need. Just highlight one person. He was actually from a Polish background. It took him and his wife numerous appointments, going to A&E numerous times, and literally got to the point where, you know, they went to their GPs that we're not going any further until we get testing for our child. And it turned out that their child had leukemia. There needs to be a point where we can really, you know, provide services in a way that people feel accessible and don't feel that they have to fight for them. So where next? What do we do next? We need more in West Sussex.
Thank you very much. With that, I cannot agree with you or the staff. And you've highlighted, I think, the question around what are the differences between West Sussex and East Sussex? What do we learn from East Sussex as West Sussex? What do we learn from Hampshire? What do we learn from Kent? What can we share? And how can we actually collaborate this? One of the things that have actually been said by BME and minority communities is we are tired. Somebody did talk about fatigue. We are fatigued because all the time you are going to be having all these conferences, all these webinars, and nothing happens. What we haven't actually touched on here, we haven't even touched on dementia for people from ethnic backgrounds. We haven't even touched on hate crime that is actually happening to people of BME communities. We had a football recently, and we know the rush that actually happened as a result of football. Some of us, when that young boy, the first black boy, missed the penalty, we knew we were done for. So we haven't even touched on all these issues. And these are some of we haven't even touched on sexual exploitation vis-a-vis the BME and minority community. We haven't even touched on domestic violence. There's so many things, but all those things can actually be dealt with if we are working effectively as services within West Sussex. The question is, how do we take this forward? And I'll pose it back probably to DRI, and I'll take it back to West Sussex County Council. I'll challenge Crawley Borough Council in as much as I will challenge health and all the others. When we talk about health inequalities, BME people say, most of the time, us as Black and ethnic minorities, services see us from a disease point of view. We don't want to be seen as diseased individuals. We want to be seen as individuals that can make a contribution to the local economy, to the local community. We are not communities at times. We are just individuals living within the community. Ladies and gentlemen, I think this has been a wonderful, wonderful webinar here. And I give thanks to DRI, I give thanks to the CCG, I give thanks to all the presenters and everyone that is actually attended. You are all valuable. Please let's keep this going. And one of the most enlightening thing that I've actually come across, there are some officers there, whether white or black or whatever, who are so much interested in actually making that change. I don't know whether it's as a result of COVID or the Black Lives Matter or whatever it is. There are some people that are saying we are tired of talking without making any difference. Thank you very much, and hoping to see you next time.